Welcome, and thank you for joining us today live or on the recording for episode 25 of Dr. Jeff Talks About Sex and Intimacy. Sexuality and yoga. It really means the world to me that you took time out of your busy schedule to learn about this really important topic. I think it's going to be one you're going to be glad you tuned into. We are out there on social media. We are out there on Facebook. We're on YouTube, X, LinkedIn, and we've been on Kick for a couple weeks. So welcome, Kick viewers again. We need 100 followers on Facebook. So please, if you are a Facebook person, if you could follow us, that would be awesome, because then we can stream some other things live and do more things on Facebook than we're already doing. So please follow us on Facebook. Go to the website. If you want to see all the incredible, extraordinary guests that have come on already since the beginning of the year, each episode is there. You can watch the episodes you're interested in. You can pull up the calendar and see all the incredible guests that are coming up in the weeks to come. So please go to the website to find all that. And you can also go to your social media sites from that website as well. And you can watch us live. You can listen to us. We're in your car. We're wherever you are on your favorite music streaming service like Spotify, Amazon Music, iHeartRadio, wherever you like to stream. We're there with you. And thank you for listening. Just want to remind you, as we always do, that all are welcome here. Whatever your sexual orientation, whatever your gender identity, whatever your relationship style, you are welcome here in this space. And we are so glad you're here because you are miraculous and incredible, and we welcome you. So the goal of the podcast is pretty simple. It is to empower and enlighten you with the evidence-based scientific information you need to improve your sexual health and deepen your relationships, helping you live and love more fully. In this episode, we're exploring the powerful intersection of yoga and intimacy, how movement, breath, I'm big on breath, and mindfulness can open us up to deeper connection with ourselves and with others. So often we think of intimacy and sexuality as purely physical or emotional experiences. But our relationships with our bodies, how we move, how we feel and inhabit them, has a profound effect on how we give and receive love. Today, I'm joined by Christina Saldanha, a skilled physician assistant, a certified sex counselor, and a yoga teacher who blends clinical insight with embodied practices. Together, we'll discuss how yoga can be a tool for healing, for presence, and reconnection in intimate relationships. Whether you're brand new to yoga or a longtime practitioner, this conversation will invite you to slow down, tune in, and rediscover intimacy, starting with yourself. Christina Saldanha is a board-certified physician associate, a certified sex counselor, a perinatal mental health certified provider, and a trained yoga teacher with a deep commitment to holistic and inclusive sexual health care. She brings a trauma-informed, body-aware perspective to her work, helping individuals and couples heal from disconnection and rediscover intimacy through a blend of clinical expertise and mind-body practices. Christina's approach is grounded in compassion, authenticity, and respect for each person's unique journey. Whether addressing sexual pain, desire discrepancies, postpartum changes, or emotional barriers to connection, she creates a safe, affirming space for people to reconnect with pleasure, presence, and their own inner wisdom. Welcome, Christina. I am so happy to have you here on the show and talk to us about yoga.
Thank you so much. And thank you for that wonderful introduction.
You are welcome. I so appreciate you taking time out of your busy schedule. You're such a great practitioner. You take such good care of your patients. And thanks for sharing with our viewers today.
Of course, it's my pleasure to be here and talk about this. This is such a interesting intersection of a topic, and it's one that I've never been specifically asked to speak on in a platform like this before. So I think it's great that we're bringing kind of this bridge to gap between medical, like as we are all medical providers here. Well, you and I are medical providers here, but then we're bringing that bridge between medical and like the Eastern world and yogic philosophy. And so I love
I do too, and I'm so excited. So without further ado, because I can't wait to hear it, it's all yours. Start your presentation.
Okay, sounds good. Okay, so everybody, we are. We're talking about yoga and sexuality in case you were confused what our topic was today. So I always like to start off with like who's talking to you and why am I here talking about what we're talking about? So I did my bio a little bit differently than I normally do. And I put it in this chronological order because these are the lenses that I have when I show up with either my clients, my patients, my audience when I'm doing a speaking presentation. I've been a yoga teacher for 13 years. I really should say that I've been practicing yoga for longer than that, probably 15, 16, 17 years. I've been a PA for 8 years, and that has mostly been I started out in gynecologic oncology, and then I moved into family medicine. And then 3 years ago, I opened my own practice that has a focus on menopause, hormones, and female sexual health. I've been a mother for 7 years. This has been my greatest opportunity for teaching and learning about myself and my position in this world, and also trying to raise little tiny humans. I have been a menopause specialist, a certified menopause specialist for the last 5 years. That stemmed from my inspiration from my cancer patients when I worked in GYN oncology. And I've been a certified sexuality counselor for 2 years. I put yoga teacher up here at the top because I feel like this trickles down into literally everything that I do, from being a mother to being a PA to how I approach menopause, how I approach sexuality. Even if it's not explicitly stated, it is the lens that I feel like I've carried the longest, and it's just kind of infiltrated throughout pretty much everything I do, which first parallel there is I feel like that's how sexuality is. It's fluid. It's fluid across the lifespan. It's fluid across different circumstances, situations. And sometimes that's all fluid and happening, and we're not even really connecting with that. And that's how I feel, similar to how yoga has been in my life. So interestingly, I found this recently, actually, and I took a picture because my first yoga class was in May of 2008, and it was actually in India. I had never been to a yoga class before, but I found this in my journal, and I took a picture because I was like, it made me laugh. And we're going to come back to this at the end of our talk today. But at 8:30 in the morning, I wrote, "Yoga was weird, and I couldn't stop laughing." And that's all I had to say about my first yoga class, is that it was weird and I couldn't stop laughing. And I'm sure if you have practiced yoga before, you've all been in a class that has felt very weird and had made you laugh for whatever reason. That's all I had to say. I didn't talk about how hard it was. It was in India, so it was naturally very hot. I didn't talk about any of the poses. This is literally all I had to say. So with that being said, oops, let me switch here. Yoga is so much more than just about postures. So a lot of times we think about yoga and we say we're going to a yoga class or we're going to take yoga. That is just one of the 8 limbs of yoga. Yoga asana is just one of the 8 limbs, and that is the postures themselves. But there's 7 other layers of yoga. And I think that it's really important when we're talking about sexuality and yoga and the intersection between the two, that we name and address the 8 limbs of yoga, because I'm going to make a parallel to how I interpret this to show up for sexuality. So besides asanas, which is the 3rd bullet point down here on the list, those are the postures. The yamas and the niyamas are 2 of the bigger, broader limbs of yoga. The yamas are concerned with the world around us, the space, the people, the things, the animals, everything that's around us. And the niyamas are focused on our internal world. So yamas are restraints, moral disciplines, moral vows, things that you kind of want to keep you in check with the world around you. There are 5 yamas: nonviolence, truthfulness, right use of energy, non-stealing, and non-greed. So these are kind of all moral values, right? That make sense. They feel good. This keeps us connected and concerned with the world around us. Niyamas, these internal duties, this internal, concerned with the internal world. There are 5 niyamas, and these are cleanliness, contentment, desire. Like, okay, how cool is that? Self-study and self-reflection, and then a surrender to whatever higher power. And that is very unique and personal to you, just like sexuality is. So those are the yamas and niyamas. The asanas are the postures. Pranayama is breathing techniques. So Dr. Jeff talked about breathing techniques, and we're going to talk a little bit about that throughout this as well. Pratyahara is a sense withdrawal. And you need pratyahara before you can get into the next 2 limbs of yoga: dharana, which is focused concentration, and dhyana, which is meditative absorption, right? So we need breathing, we need a sense withdrawal, then we need focused concentration, and that's how we collectively arrive to meditation. And then the 8th limb of yoga is samadhi, which is bliss or enlightenment. So that's like when you have arrived at a point of self-realization. So this is pretty typical and standard definitions of the 8 limbs of yoga. But to me, when I reflect on this, I like to think about how this shows up, or what this could mean for sexuality, because it could seem clear, right, that some of the things that I just described between the yamas and the niyamas could make sense how it shows up with sexuality. So let's talk about that. Yamas, again, remember, are concerned with your outside world and your environment. So the things that I think of are consent, recognizing consent of your partner or partners, non-coercion, respecting their boundaries, and understanding your partner's wishes. What are their desires? How are you showing up to interact with them where it's mutually pleasurable and satisfying? Niyamas, again, tapping into your internal desires, your internal worlds. And so understanding what your desires are, self-reflecting on what you want, what your fantasies are, self-eroticism, how things are showing up for you in your mind and in your brain that are contributing to improving desire and arousal. Asanas, again, postures, you could think of that physically, like positions during sex, but also how is your body showing up, and how are you connecting with your body when it's showing up in these certain positions? The most important posture, and I'm not going to say it in Sanskrit because it's not one that I typically use when I'm teaching yoga class, but the most important posture is a posture that you can hold comfortably and motionless. So a lot of times when I'm teaching yoga, I'm asking people to find a shape in the position that we're in where they are no longer correcting, judging, fixing, prodding, but they are merely just existing in that pose, and they are breathing. And that, not that we are motionless during sex, but that same kind of principle can be applied to sex and the positions of sex, is finding positions that are comfortable, where you're not judging, you're not spectatoring, right? Like we're not watching ourselves from an outside, out of our bodies and watching ourselves what we're doing. And so really finding that position and where you're feeling very comfortable, and that way you can be in the present moment with yourself and with your partner or partners. Pratyahara is, or pranayama is breathing during sex. So it's a way to focus in on the moment. Breathing may change during sex. Breathing may become more erratic to meet the demands of, physiological arousal, but also using breath as a way to connect back in with your body, with your moment, with your partner, paying attention to the way your partner is breathing. Pratyahara is the sense withdrawal. And some people might say, well, I'm not trying to withdraw my senses. I want to explore my senses. But it's more of a sense withdrawal to within. So ignoring all the senses around you, ignoring all the noises, the sounds, the possibilities, what's happening in the outside world, and withdrawing back into yourself and your partner and focusing on the senses then. So sometimes I'll have not not my yoga students, but when I'm working with a couple or a client, I'll have them like talk about naming senses during sex that they can focus in. It's just a grounding technique that sometimes we even use for anxiety or anything else when we need to ground. So we can focus in on our senses during sex to ground in that moment and stay connected with ourselves and with our partners if we're having partnered sex. Dharna, DHA means holding or maintaining. So again, focusing in on the breath or even focusing in on your fantasies. So with fantasies, again, something to not hold judgment for and to not hold necessarily attachment to, but allow it to for your mind to wander, because this is going to improve self-eroticism. And it's also going to improve potentially desire, arousal, and partner satisfaction. Dahana is like when we are really meditating. And, I pose this question, is sex meditative? Because I think in a lot of ways it could be, right? We're focusing on our breath. We're focusing on our own body sensations. We're connecting in with our experience. We're not holding judgment. We're not holding shame. We're not holding necessarily attachment to what should or should not be happening. And I think a lot of times when people are reporting dissatisfaction with sex, it's because we have these expectations that a lot of times are put on based on society or our past experiences, or sometimes our partners or past partners or religion or whatever else is showing up in the bedroom. But for Dahana, is kind of like meditating in on that moment and that experience. And so for that reason, I do think sex can be a meditative practice. And then samadhi is when you have reorganized your relationship with the outside and the inside world. And this is when you have arrived at a self-realization and really true satisfaction with oneself and satisfaction with oneself, and then also letting go of all the other extraneous expectations. So types of yoga, I put this on here just as a picture. This is not all the types of yoga. These are just the ones that come to mind when I think of types of yoga. You have hatha yoga, you have ashtanga, you have vinyasa, you have tantric, you have kundalini, you have yin. My specific focus as a teacher and as a yoga student is on hatha yoga, which is a very stark combination of postures and pranayama, asana and pranayama. So balancing movement, more static movement with breath. But then you have ashtanga, which is a specific set of postures in a sequence, and they're focused on building an internal heat, and you're also focused on moving with your breath. Vinyasa is more of a flow style, connecting breath with movement. Tantric is more associated with sex and can actually incorporate sexual activity. Do you have to be practicing tantric sex to use the principles and philosophies of yoga to kind of help embody your life and improve and kind of help you reconnect with sexuality? Absolutely not. I just have it here for kind of completion, because sometimes when we talk about yoga and sex or yoga and sexuality, people are like, why do I need to be doing some tantric yoga? And my answer is always, if you want to. If you want to, which is always my answer for anything. Whenever anybody's like, should I try this position or this type of sex act? I'm like, if you want to, like, and you are consenting with, somebody, if you're doing it partnered. Kundalini is an awakening of the channel of energy at the base of the spine, or tapping into your feminine energy, with which no matter what gender you identify with, we all have feminine energy within us. And then yin is more of a slow paced yoga practice. Poses are held longer. You're focused on relaxation and elongation of your muscles and fascia and ligaments and tendons. So just like there's lots of types of yoga, there's lots of types of sex. And I am not here as a yoga teacher or as a sexuality counselor to ever instruct people which type of yoga they need to do, or which type of sex they need to be having, or what type of sexuality they need to be defining for themselves. It's all about self-exploration and self-discovery within both of these realms, right? Yoga and sexuality. So erogenous zones and pleasure mapping, this is where I really start to see the bridge between yoga and sexuality. So yoga helps us get familiar with our bodies in weird shapes. And a lot of times our bodies are having weird shapes and weird sensations during sex. And so I think yoga helps us really get connected into these weird shapes. Yoga can be very vulnerable, and so can sex. But I think the more we become more accepting and more familiar and more, then we can tap into like enjoyment and pleasure and satisfaction, right? And so yoga helps us understand what feels good, what does not feel good, and how to breathe when you are there. Something I say a lot of times when I'm teaching yoga is if you can figure out how to breathe in during the discomfort, or and not even physical discomfort. Sometimes it's mental discomfort while you're practicing yoga because maybe you're stressed out. Maybe you just kind of don't want to be there. Maybe you're worried about something. Maybe you're creating a grocery list for the grocery store and putting mayonnaise and pickled onions and some bread on there. And so you're like, I got to get out of here. But I say if you can go back to the breath, then you're learning how to stay in that present moment despite what else you have to do outside of the yoga room. Same thing with sex. We are understanding how to stay connected in and how to breathe normal and enjoy the experience while we are there. Because as I have learned, we need to be focusing on, for example, good enough sex. And I tell people that in the yoga room, we need to just be focusing on good enough yoga. You have showed up to the occasion. Let's make the best of it. In my opinion, it doesn't matter what type of yoga you are doing. What matters is your consistency. Your erogenous zones are zones in your body that feel good and feel pleasurable. And we can figure these out through pleasure mapping. And these are zones in your body that expand outside of the genitals. It's not all about genitals. The definition of sex is not genital to genital touching, right? The definition of sex is connection with oneself, connection with another person or other people. And so erogenous zones, thinking outside of the body. Obviously, you're not necessarily in a yoga class going to be exploring your genitals, but you're going to be exploring other areas of your body. And I think that's so important to encourage folks to also do that with their bodies, with sexuality, exploring zones that feel good and are pleasurable and help us feel connected that are outside of the genitals. And then pleasure mapping, what feels good, and exploring temperature, texture, and pressure. Again, I feel like once you can explore your body, your breath patterns in a yoga class, it allows you the opportunity, it allows one the opportunity to continue that and kind of explore how does that look sexually as well. So when I was putting together this presentation, I was like, what if somebody asks me like what yoga pose they need to be doing to have sex? And so I just like Google searched this because I was like kind of curious what was going to come up. And so you come up and you've got this list. And then if you scroll down on this screenshot, you would see a bunch of different poses and that you should do. And this is problematic because it does not matter what you are doing. It matters how you are doing it. And as I explained through the 8 limbs of yoga, asanas or the postures are just part of it. And they're just honestly a really, really small part of it. It's all about the niyamas and the yamas and the breathing and the meditative aspects and the withdrawing of the outside senses and interning senses, right? That, all of that collectively and in varying degrees and percentages is what helps improve sexuality. It's not just a specific posture. It's what you are doing both on your mat and off your mat. And some people will say the real yoga happens off the mat and not even in a posture. So consistency is important. And when you are focusing in on those postures alone, you're really missing the other 7 layers of or 7 limbs of yoga. And that's the juicy part. That's the juicy part. And sexuality is complex. Yoga is complex. Yoga philosophy is very complex. And so a lot of times when people are approaching yoga and they're like, well, just tell me what to do. Or sometimes people will say, can you do a private yoga class with me so you can just show me what the postures are supposed to look like? And I say, no, because you've got to explore that for yourself. Because if I just show you what it looks like on my body, that may not be what it looks like on your body. It may be completely different. And that's appropriate and anticipated. And it is a journey for you to kind of figure out on your own. So same thing for sexuality. Sometimes people show up and they want just a simple solution. And very, very rarely is there a one answer. It's usually very nuanced and very layered. And so that is why like a Google search like this of like, what yoga postures do I need to do to like improve my orgasm response is not, to me, it's just not going to cut it. We need to do some self-exploration. So 6 domains of sexual function from my perspective, because I mostly treat females or vulva owners, is pain, arousal, desire, lubrication, orgasm, and satisfaction. So I think of the 6 domains of sexual function similar to the 8 limbs of yoga. These are all the different things that we can think about that occur during a sexual encounter. And sometimes they occur without an issue, and sometimes that is actually where the issue lies. So when we think about this is an old slide, and I never can find any picture that I like well enough to help me explain this sexual tipping point. So you've got enticers and you've got suppressors. You've got things that are going to improve kind of that sexual response, that sexual desire. And then you have things that are going to absolutely put the brakes on this and cause sexual avoidance. And so what I wanted to do was kind of take this a little bit of a step further and kind of explore and explain and think about how yoga can actually improve these different things on the sexual tipping point. So on the enticers, when we talk about testosterone, so testosterone is not a gendered hormone. All bodies have testosterone, some in different proportions than others. For most people, we think of it as a sexual hormone that helps improves desire and sexual response. And this may be true for some people. It's not true for all people, but we do know that exercise alone helps to improve testosterone, particularly in cisgendered men. So that's something to consider. And then when we think about physical and genital stimulation, exercise increases genital blood flow. So it helps improve lubrication, erectile function, and orgasmic response. So that's any type of exercise. We can classify asanas as part of that. And then all of these under physiological insiders, like not really attractive partner, doing yoga is not going to make you more attracted to your partner necessarily, but like erotic stimulation, cultivating fantasy, love within yourself or with the people around you, and courtship, even courtship of yourself, those can all be improved with all the 8 limbs of yoga. And then for sexual suppressors like hormone disorders, this really depends on what the disorder is, but exercise and yoga may help for people that have ovaries, who are wanting their ovaries to be functioning and doing all the things that the ovaries do. Sometimes this can help restore balance and ovulatory function there, which may help with desire and lubrication and other things that ovary hormones do in those bodies. And then depression. We know that a regular yoga practice is going to improve depressive symptoms. And stress, anger, negative emotion, a regular yoga practice, I think we can all say that makes sense that is going to help with that. But you don't have to believe everything I say. And as a medical provider, I'm all about what the evidence says. And so what does it say? So yoga increases sexual functioning in women. And this is a specific study that studied women 45 and older in all 6 of those domains. So it improved anybody who had problems with pain, arousal, desire, lubrication, orgasm, and sexual satisfaction. Yoga increased functioning in all 6 of those domains. And that was a meta-analysis that looked at many, many different studies. We also have found evidence has showed that yoga improves blood flow to the genitals, individual strength, like overall body strength and control of your bodies. And balance and coordination is so important as we have aging bodies and our balance and mobility starts to change. And so that shows up in the bedroom a lot with positioning and people feeling confident and safe in their bodies and space. And so improving balance and coordination, I have to imagine, would also improve sexuality. Improving body perception and connection to our aging and changing bodies. So we know that how we view our bodies can sometimes make us feel not as sexy or not as desirous of sex, or also kind of tamper down arousal and lubrication, particularly in people with vulvas. And so yoga is going to help improve our body perception, connecting in with what our body is doing and what it looks like and what it feels like. And then what about other exercise? Like, is this true for all exercises? In one meta-analysis, it showed that aerobic exercise showed inconsistent results. So it was neither negative or positive. It just was all over the place. And then resistance training seemed to have no benefit on improving sexuality. So this really does seem to be that you get the most bang for your buck with yoga, which I think is so cool. So to kind of end things up, I replaced the word yoga in my journal entry from May 16th of 2008. Instead of yoga was weird and I couldn't stop laughing. We could insert sex here. Sex was weird and I couldn't stop laughing. Sex is adult playtime. It should be fun. It does not always need to be procreational or relational. It can be recreational too. And as we get older, and sometimes when we enter in long-term relationships, that recreational part kind of, it can go away if we don't think about it and consider it. And just to kind of conclude and draw some additional parallels, sex and yoga have a lot of similarities. So it requires you to be present. It requires to show up exactly how you are. There is no changing once you kind of arrive at that moment. You are showing up exactly how you are. Both require exploring your body and getting comfortable and confident wherever your body is at. And this is an ongoing process. It's not like we explored our bodies when we were 20 and then that stays for when we're 50, 60, 70, but it's an ongoing body exploration process. You're exploring sensations, how things are feeling, what your senses are doing, and acceptance of where you are at in your life with your body, with your relationship. And yoga and sexuality are for anyone and anybody. Anyone and anybody is deserving of exploring yoga and also being true to their own sexuality. And both yoga and sexuality are a journey. They're not a destination. There is no goal. We really should get away from goal-oriented sex. We should get away from goal-oriented yoga practice, right? It's all about the journey and what's happening in that very moment. And with that, that concludes my chat. I have my contact here. If anybody needs to contact me or has any questions or just follow-up comments for me afterwards, that's there for you.
Wow, thank you so much. It was awesome. Really, really great information. I love that yoga has the biggest bang for your buck.
You do. You get the biggest bang for your buck.
And I think that's really true. But it makes so much sense because it's about getting in tune with and staying present in your body and that journey, like you said. And I think that that's really important for viewers to understand. We're so goal-oriented. It's about the destination, where I got to go. I have to have my goals. If I don't have my goals, well, I get, when it's like being present and really fully embodying the journey, often that is the most meaningful thing for people with sex and yoga.
Yeah.
I think it's really, I think there's such a great intersection between the two. I also like I love the word play. I always talk about love play with my patients because play is such an underrated thing and so important with what patients are doing with sex and intimacy. And so I think having fun and playing with your partner is a powerful, wonderful skill. And I think yoga too. We have to, I love how you talk about laughing because we have to learn to laugh at ourselves. I mean, it's like totally, as we get older, there's a lot you better be laughing about because it gets pretty crazy, so I think it's really good.
Yeah. We can't take anything too seriously. And I think going back to that play is so important. I mean, children are so imaginative and playful, and we as adults are terrible at being imaginative and playful. We get jaded by the world around us. And I think sex is a great opportunity for us to kind of like tap back into that playfulness and whatnot.
Definitely. And, I'm excited for you. I know my children teach us so much about being present and fully embodied in the moment. It's just, they just do it. That's where they are.
Natural. I know. And I'm always thinking, can we just bottle this up and you just continue this for life?
For sure. And, it's that Buddhist thing of approach it with a beginner's mind, a child's mind, a new mind, and I think it's really a good thing. Well, I have a couple questions for you. Here's the first one. Is there a way to bring yoga into a relationship or an intimate partnership without it feeling awkward or forced?
That's a great question. So I tell people that whenever you're starting anything new, normal for it to feel awkward, and sometimes it may feel forced, but I wouldn't really shy away from that. I would kind of just welcome that and just kind of sit with that discomfort. It's kind of like in yoga, there's going to be positions that are uncomfortable, but they may not, that doesn't necessarily mean it's harmful or it's bad or you shouldn't do it, right? It's like fine, it's showing up and figuring out how to be present in that moment. And I would say, like, don't try anything in the bedroom for the first time ever with a partner. Like, sometimes you have to explore things for yourself, right? Before you show up with your partner, because that's
Mm.
very vulnerable. So, like, even if you're maybe asking your partner to go to a yoga class together, I feel like that offers a lot of connection with partners when they're going to anything together. Actually, there's research that shows that when you do something new together for the first time, you actually have improved relationship satisfaction, but also sexual satisfaction. And you're more likely to have sex when you're doing something new outside the bedroom, like a new hobby or a new anything. And so I would say just kind of lean into that discomfort, because it gets you out of your comfort zone, and that's where you grow. And I think that's where you'll be able to explore more.
Right. And it makes a lot of sense. And we know that new novel activities also increase dopamine levels, which makes us want to cuddle more, makes us want to bond more, and is a very pro-sexual neurotransmitter. So there's scientific reasons for all these things. But I do think that's great. Go take a yoga class together and just explore it. And I think that's good advice too. I tell my patients a lot of times, even when I prescribe some of the medicines, I'm like, try this on your own a little bit so you get comfortable and confident with what's going to happen and how it's going to work and what dose is going to work for you or whatever, right?
Right.
Um, so I think that can be really important, definitely. Second question. Can you recommend any simple poses or practices for someone who's brand new to yoga but wants to explore how it might support their sexual wellness? Where do they start with the poses or whatever?
Yeah, that is so great. Of a question, and just kind of like, yeah, where the heck do you begin? I always say you need a teacher. You need a teacher. If this is something new, I think sometimes when we're like, well, I want to do something in private and just figure it out on my own, because they're maybe embarrassed or you just don't even know where to begin, right? And so I say you need a teacher. What that looks like may vary vastly, right? And so if you have access to a yoga studio, I would ask them, I'm a beginner. Where do I start? Ask for help. You do not have to do this all on your own. Again, sometimes we become hyper independent because we're like, I just got to figure this out for myself. Ask the studio owner, I'm a beginner. Where should I start? What classes do you recommend for me? If you don't have access to a studio or you prefer not to practice in a studio, the internet, the world is your oyster. There are so many YouTube channels, and I don't have any specifically that I recommend, but I know a lot of my patients just go on there. Again, this part of this is about exploring what works for you and exploring what is you're comfortable with. And that begins even before you get into the posture. It's like, let me do a YouTube search. Let me see who I'm connecting with, whose body maybe mirrors mine. And that's how I feel comfortable and safe to show up, even if they're not live. I personally really like the Peloton app. Even you don't need a Peloton bike or a Peloton tread to have the app. It's a pretty low monthly fee of $13 a month, and they have so many yoga classes on there. You can set it by what time limit you want to do, 10, 15 minutes. You don't need to be like, I got to do an hour of this for it to work. Again, it's about consistency. It's about showing up. It's about what you are doing, and it's about how you are doing things, not exactly what specifically you are doing. So I know I didn't really answer the question of what yoga postures, but I think part of it is kind of figuring out what looks good. Like my first yoga practice is not going to be the same as everybody else's. I practice a very specific form of yoga, Bikram yoga, hot yoga. That's not going to be what's going to work for everybody. Some people prefer yin. So I think it's just about self-exploration, connecting in with a yoga studio in town if you have one and asking them specifically, or just doing some YouTube views.
Yeah.
Apple
So,
Fitness has yoga with trainers. Yeah.
so hot yoga. You're doing yoga outside right now? Because I know it's real hot there.
That's so funny because I taught this morning and I was like, we have arrived at the time of year where it's cooler in the room than outside. So come in and you'll cool off because the temperature in the room is 105 and the temperature where I'm at has been over 100. So
We got some serious hot yoga going on in the United States right now. That's for sure.
absolutely.
And also, if you go back, viewers, we had a previous episode on yoga, and there was a whole recommendation of a website for someone who had a bunch of things on pelvic floor stuff in yoga, and there's some good things there too. From that previous episode where there was some yoga demonstrations and things like that, more focused on pelvic floor specifically with that one, but still lots of great resources. Like you said, the world is your oyster on YouTube or whatever. It's so much out there. It's amazing, definitely. Well, what I'd like to do is I'd like to do a centering exercise, as I always do, as we close, as we move towards closing. So all of you who've been here before kind of know how this works. Let's take a moment to close with intention. Let's find a comfortable position, seated, lying down, or even standing tall with your feet grounded. If it feels safe, you can gently close your eyes or soften your gaze. Take a slow, deep breath in through your nose and exhale softly through your mouth. Keep breathing that way as you let your shoulders relax. Let your belly soften. Let your awareness gently drop into your body, not to judge, just to be authentically present. Now, keep breathing and bring your attention to your heart space. Feel the rhythm of those deep breaths in your nose and that soothing exhale out your mouth. Steady and alive. Silently repeat these affirmations. Why is it so healing to slow down and be present in my body? I deserve to feel connected, safe, and worthy of intimacy. Why is listening to my body an act of love? My truest self is pure love. My authentic, purest self is true love. Take one final big breath in. And as you slowly exhale with gratitude for the space that you've created today, when you're ready, gently open your eyes, carrying with you a deeper sense of awareness, compassion. We need more compassion in the world, and connection, because we're all deeply and intricately connected. Well, I'd like to talk a little bit about what's up in this next episode. So, Vic, what do we got next week?
What exactly is pelvic floor therapy, and who really benefits from it? In this in-depth episode of Dr. Jeff Talks About Sex and Intimacy, we sit down with Dr. Carrie DeFuss, a highly respected urology nurse practitioner and pelvic health specialist. We will explore how pelvic floor therapy is transforming the lives of patients with urinary incontinence, pelvic pain, and sexual dysfunction. Join us on July 1st at 7 p.m. Central Time to learn more.
Well, Christina, it has been such a pleasure. What beautiful things you brought into the space with this episode. And I so appreciate everything you taught us and sharing your expertise in yoga and sexual health with us.
Thank you so much for having me.
Is there anything else that you would, as you think about it, that you'd like to share with our viewers and as we close out our session?
My last comment would just be to remember that sexuality and a yogic practice are fluid across the lifespan, and showing up exactly who you are and being your authentic self, whether that's on the mat, off the mat, in the bedroom, wherever you are engaging in a sexual activity, is the most important part.
Definitely. That's the greatest gift we can give is show up as our true self and truly be present with each other. And I wish and hope and pray that for you, all of our viewers. And thank you so much for joining us this evening. Have a great one.